Well, you got a great staff.
Thank you.
I mean, that's where it all starts. I mean, it starts with the processing and bringing the patient into the room, and then everybody focusing around that specific patient.
Okay, Dr. Deuk, and it's March 5th, 2021. I'm here with one of my patients who underwent Deuk laser disc repair yesterday, less than 24 hours ago. And he had 4 herniated discs. Bit unusual for people to have 4 discs that are symptomatic. We see lots of patients with degenerative disc disease, herniated discs, and usually it's only 1 or 2 that are causing pain. But I was concerned when I first met him because his pain really ran the gamut from about L2 down to the sacrum. So we looked at his MRI and there were definitely 4 herniations. And we offered him the Deuk laser disc repair or fusion. He didn't want a fusion, and I'll let him talk a little bit more about that. How long did you have back pain before your surgery yesterday?
I've had back pain for about 4 years.
4 years,
Yeah.
okay.
On and off.
On and off. And I know you were in the military. We were just talking about that. But you and my father were both in the Army.
Yes.
And were you suffering with pain when you were serving?
No, not really, because we ran every day and jumped out of perfectly good helicopters.
Do you think that contributed to the development of your problem?
I don't know. I think it mostly happened after the military. I retired in 2000. So it's been 21 years. I don't think the military, it may have had some beginnings, but I don't believe it was directly responsible.
Okay. Now you had an opportunity to have other types of surgery besides endoscopic Deuk laser disc repair. What other surgeries were you offered, and why did you choose the Deuk laser disc repair?
I believe you offered me the spinal fusion. Mm-hmm. And we looked at the difference of the incisions, 7 millimeters versus somewhere around 12 inches. Yeah. You did a nice drawing on my back, I understand, yesterday to show, as you're doing your tutorial, this is the distance it would have been, and this is the distance it really is. I believe you went in and did 3 of the herniated discs in 1 incision. You lengthened that incision just a bit to see if you could do the 4th disc, and you came back and did another incision to make it a lot easier.
Well,
or better.
Safer.
Which was fine with me because I didn't really feel it.
Good. So your surgery took about an hour and a half to do. You left the facility an hour later, and here you are today. Do you still have the back pain you've had for the last 4 years?
No, it's gone.
Cured?
Yes.
Awesome. And are you on powerful painkillers right now?
No, in fact, I mentioned to Dr. DeMola this morning. I said I took them last night at 8 o'clock, which is a little bit past when they could have been taken, and I took it at 8 o'clock this morning. So really, it's just for discomfort, and I'll probably take 1 more pill of each and stop.
So you took a muscle relaxer.
And a pain pill.
And you took the anti-inflammatory.
Right.
But you're not on opioids.
No. That was the other thing that you mentioned to me. Opioids versus regular pain medication, or a little bit of pain medication, and nobody wants to be on opioids.
No, but had you had the fusion, you'd be on them for about 2 months to 3 months. So you have all your faculties. So your back pain is gone that you had for 4 years, and how about the leg pain that you had?
That's interesting because last night I was wiggling my toes, and it's a lot better now. And I feel like as the nerves tend to regenerate or go through the healing process, that I'll be able to actually stand on my toes again, which I couldn't do. I haven't been able to do for years. And I didn't even know it until about 2 years ago that I wasn't standing on my toes. It was just like the body was trying to cover it up.
Yeah.
Now I'm looking forward to that, getting the balance back completely, which was one of my primary goals. In fact, I'll tell you this, share this with you. My wife saw me doing my 23 minutes of walk this morning, and I did 12 minutes last night. And she said, "You're walking better than you have in years." And and no pain.
Now I want to ask you something, and we're gonna do it here on the camera,
okay,
so the whole world could see.
Okay.
We were treating TRICARE patients, military patients, for a couple of years with the laser surgery. And then Humana put the kibosh on that and tried to prevent military from being able to get it. And we went to trial and we won. Deuk Spine won. And the military said that the Deuk laser disc repair is medically necessary and should be covered.
Right.
So I would love to have some type of a commitment from you to helping work with us to make that happen.
I will.
What was your position in the military? What did you retire as?
Lieutenant Colonel, and I went to the Army War College, so I was a Mel 1, or the highest education you can get in the military. And it was a great time. But
Yeah.
I think the TRICARE, absolutely. If you can do this type of surgery versus the more invasive one, why wouldn't you do it? Why wouldn't you commit yourself to doing that? And I don't know what the expense is for either one,
It's
but I assume
much cheaper for the laser surgery, no narcotics,
Right.
back to work quickly. Obviously there are restrictions, but once you get past the healing phase, you can do whatever you want in the military.
Well,
no
I agree.
restrictions.
Why wouldn't you do that though? I mean, why wouldn't you have that as a possible alternative or an alternative?
It should be available.
There
The
you
problem is I don't know the right people. I'm not connected.
I could probably help you get started with that
That'd
with
be wonderful.
a few friends of mine.
Excellent. Well, is there anything else you want to say to the rest of the world?
Well, you got a great staff.
Thank you.
I mean, that's where it all starts. I mean, it starts with the processing and bringing the patient into the room, and then everybody focusing around that specific patient. I remember a lot of the conversations. There was a lot of familiarity in the operating room, which is great because it's esprit de corps, and it is definitely a positive influence on just having hear that people are working well together. And you've got a great state-of-the-art room. I made sure I took a good look around. I've never seen a surgical room quite as impressive as that, and I've seen a couple. And then it ends with you, and then it ends with the follow-up. But special thanks go out to all the staff, Gary, Crystal, I think.
Yep. You got it.
And let's see.
Our director of nursing.
Jen, Ray, Courtney, Dr. Deuk.
A lot of people involved in your care, right?
Exactly. A host of people.
It's not a one-man show, that's for sure. Just like in the military, one person can't do it all.
It's a team effort, and you're leading the team. And the tutorials that I heard you were giving, as far as I was concerned, was instructive to me as the patient laying there, and you talking and putting your hand on my back and going through that process and saying, I'm right here, and you were.
Well, I'm glad it was a good experience for you, and as I said, we're going to give you a copy of that whole surgery in the operating room experience for you to keep.
Great.
But most importantly, you came here for a reason. It was to get rid of the back pain
Absolutely.
and the leg symptoms, and they're gone, and I'm very happy for you.
And I'm looking forward
Let's
to
keep it that way.
6 weeks and moving on.
Yes, sir.
And for the year.
Thank you so much.
Look forward to seeing you.